Hi everyone, my name is Ronelle Memchik and I work as a tobacco treatment specialist with the Philadelphia Department of Public Health, Chronic Disease and Injury Prevention. Today we're going to be discussing a very important topic, racial injustice and tobacco use. The learning objectives for today's presentation is that participants will identify the connection between racial injustice and tobacco use in Philadelphia. Understanding how reducing tobacco use can help decrease things like poverty, as well as other health differences, will allow others to lead a safer and healthier life. This e-module is relevant to staff who serve families with young children because Philadelphia's high poverty rate affects communities at multiple levels. Understanding how tobacco companies target specific groups of people show the influence it can have on someone's ability to make healthy choices. When we think about what goes into a person's health, a lot comes to mind, including things like maybe the foods we eat, how much exercise we get, or even access to things in the neighborhood in which we live. Tobacco use is another important factor that goes into someone's health. Tobacco use nearly harms every organ in the body and can cause major health issues such as cancer, heart disease, stroke, lung disease, just to name a few. It can also play a role in how often someone might get sick or how long it might take for them to recover from their illness. It can also affect someone's quality of life, making it really challenging for them to maybe walk up a flight of stairs without getting out of breath or going outside in the yard to play with their kids. A study that was done in 2020 titled Smoking and Vaping in Philadelphia found that lower income groups were more likely than higher income groups to use tobacco products like cigarettes, cigars, or smokeless tobacco. Youth identifying as LGBTQ were also at a higher risk for using tobacco products than their non-LGBTQ peers. Now let's take a closer look at Philadelphia. Philadelphia is one of the poorest large cities currently that we have in the United States. There is a strong link between poverty and engaging in unhealthy behaviors, like smoking, for example, that can lead to negative health outcomes. Poverty can also have a huge impact on things like increased crime, homicides, drug use, and even unemployment within a community. This chart shows the smoking rate in Philadelphia compared to the ongoing poverty level throughout the city. On the left side here in blue, we can see that a family of four whose income is about $42,000 or less per year makes up about 30% of tobacco use in Philadelphia. In comparison, on the right-hand side, or in orange, we see that a family of four whose income is about $83,000 or more per year makes up only about 11%. The key thing here that we can take away from this slide is that the lower someone's income is, the higher the rate of smoking is. Let's think about that for a second. That means that people who may be struggling to pay for things like their groceries or maybe a utility bill are those same individuals who are still finding a way to use their limited or fixed income to continuing purchasing their tobacco products as well. Nearly 1/3 of adult deaths in Philadelphia are caused from smoking. This can include death from heart disease, cancer, stroke, respiratory disease, and diabetes. There are nearly 4,000 Philadelphians that die every year due to cigarette smoking. For comparison, that's enough to fill more than 34 60-foot SEPTA buses. Advertising plays a huge role in whether or not people buy things, and tobacco use isn't any different. Millions of dollars are spent every year on advertising, packaging, signage for tobacco products. When it comes to tobacco companies advertising their products, it's not an accident that there is much more advertising happening within Black communities compared to other communities. Tobacco companies have strategically targeted Black communities with menthol cigarettes for decades and have even sponsored cultural events like hip-hop festivals or jazz festivals. Studies show that there are 10 times more ads in storefronts in predominantly Black neighborhoods than any other group of people. Menthol is a flavor additive that smells and tastes just like mint. This helps to mask that harsh taste of tobacco by giving off a cooling sensation to the user. It is also harder to quit smoking if the product does have menthol in it. Other products like flavored cigarettes have previously been banned because they can be very appealing to younger generations. However, menthol cigarettes are currently not under that law. When we look in a little bit further into the smoking rates in Philadelphia, we can see and pick up on several trends regarding tobacco use. On the left-hand side here, we can see areas that are either red or orange, and that's going to display a higher smoking rate in Philadelphia. On the right side, a lot of those same things, same areas, that were in that red or orange area are also living in poverty as well. In this picture here, we can see that those same low-income groups or neighborhoods have a high concentration of tobacco retailers throughout their neighborhood. So this means that the zip codes that were in the red and orange on the previous slide I just showed also have a high rate of tobacco products being sold throughout their community. Next, we're going to compare two neighborhoods in Philadelphia together. The first one is Chestnut Hill. This map here shows a child that would walk 3/4 of a mile to school every day in Chestnut Hill, and it shows that they would pass one tobacco retailer on their way. So now we're going to take a look at another neighborhood, North Philly. A child that walks 3/4 of a mile to school every day in North Philly is actually going to pass 16 tobacco retailers on their way to school. Over the years, there have been a lot of evidence that has shown that tobacco companies deliberately do this to target specific communities or neighborhoods in general. This active targeting is happening in other communities as well, besides just low-income populations, including LGBTQ, Hispanic and Latino, individuals with behavioral health conditions, and Asian Americans. Tobacco companies have done things in the past like give away coupons, provide free cigarettes with food stamps, giving away free merchandise to really try to connect with the population and really get people hooked on being their #1 brand. Secondhand smoke is the smoke that's basically coming off of a cigarette or the smoke that's being exhaled by the person who is smoking. This smoke can be breathed in by other people around them and contains more than 7,000 chemicals. African Americans have a higher exposure to secondhand smoke than any other group of people, and there's also a high rate of people dying as a result from secondhand smoke in the African American and Hispanic and Latino population. There is no safe level of exposure to secondhand smoke, and the best thing that we can do is to try to stay away from it. It can be very dangerous. Something else that I want to mention here is what we call third-hand smoke. A lot of people are unaware of what that exactly is. Third-hand smoke is found in the residue left from the chemicals of a tobacco product. So when someone is exhaling or it coming off the cigarette itself or tobacco product itself, those chemicals really seep into different materials around us. So things like our hair, our clothing, carpeting, furniture, they can all seep into that material and just kind of stay there and linger around. So if we think about that for a second, a child might be, crawling around on the floor and someone is smoking inside the house. They might be putting toys in their mouth or even their fingers, not realizing that all of this third-hand smoke is potentially getting into their child's mouth or essentially breathing it in around them. So even though many people might open windows or spray things like Febreze or Lysol, this does not get rid of the third-hand smoke in the air or on materials. So very, very important key factor here that we want to keep in mind when we're working with patients. So what can you do to help reduce tobacco use? You can help by supporting tobacco users and seeing if they are interested in quitting smoking. Clients can be referred to the PA Quit line, whose website is linked here, or they can call 1-800-QUIT-NOW. You can help by changing norms and raising awareness about tobacco use and the effect that it can have on others. You can address things like secondhand smoke and third-hand smoke by protecting others both indoors and outdoors. And the #1 thing that we can really do here is to prevent young people from even starting to use any tobacco product in the first place. If anyone has any questions, please feel free to contact me directly by phone or email. It's listed here. If you would like more information, please feel free to visit our website, which is smokefreephilly.org, which is also linked here on the page. Thank you very much for your time, and I hope you enjoy the rest of your day. Thanks so much.